Good day, my friends. This is your doctor, Dr. Digambar Naik. Today you find diabetes is a real dreaded disease. By the time you reach your 50s, you're all worried about this problem, and rightly so. In fact, I would say in India, by the time you are 30s, you must start looking after your blood sugar levels. Diabetes is of basically two types. One is type 1 diabetes and type 2 diabetes. There are other types of diabetes which usually you don't have to worry. One is called the maturity onset diabetes of young, that we call it as MODI, and especially the pregnancy diabetes, that's called gestational diabetes, which occurs during the time of pregnancy. Well, these are specific problems and your doctors will look at it. But these two types, type 1 is the one which comes to you when you are very young, even for a newborn. In this diabetes, your insulin is not manufactured by your pancreas, because the pancreas is, beta cells into your pancreas are dead. And you need insulin for this type of diabetes. And your doctor has to really make a proper diagnosis to see that this is type 1 diabetes. Your second diabetes is type 2 diabetes, is what we are all worried about. It is this diabetes that we are all suffering from today. And most of it with us is a type 2 diabetes, which we call it as a lifestyle disease. I think over a period of time, I would like to give you a lot of information how to live a completely normal life in spite of having diabetes, or how not to have diabetes, which is so rampant in our country. Almost 20% of the adult population today are suffering from diabetes. Friends, if you have diabetes, you have three choices. Number one, control it properly. Take care about your diet, exercise, and see that it is kept under an absolutely good control. Then you will have a complete life of yours which will go without any complications, and you will be able to live your full life for yourself. The full life God has given you. And to me, God has given you 100 years of alert, active, and a life full of vigor. This is one choice. Second choice that you have is, don't worry about it. Eat whatever you want, do whatever you want, whatever you have been doing. Don't listen to your doctors. And you are sure to suffer from all the complications that we are worried about today. Complication of kidney damage, eye damage, early stroke, early heart attack, leg damage, leg cutting, leg ulcers, and all these sort of things. But today, you have one more choice with you. You can get rid of your diabetes. It's up to you and your doctor to work together and throw this diabetes out of your body even after it has come. Friends, you can do it today. Can you imagine if you do not have diabetes up to the age of 80s and 90s? Can you imagine how good life you are going to live? Go ahead and live that life God has gifted us, my friends. Thank you so much.